I'm going to talk to you about breathing and relaxation. Some women find that practicing breathing and relaxation during the pregnancy makes it come more easily when they experience pain or tension during labor. There aren't really any patterns that work for all women, but there are some that I want to share with you that have several things in common. Learning a breathing pattern enables you to have a steady and adequate intake of oxygen so that your uterus can do the work of labor. We know that when you have a contraction, that there is a decrease in the amount of oxygen that goes to the uterus. So when you take these breathing patterns and begin to have steady breathing, it ensures that the baby is getting adequate amount of oxygen. Breathing in a pattern can also be a distraction for you from the sensations that you might be experiencing during labor, sometimes called pain. You're distracted because it requires you to be able to concentrate to keep your breathing steady and to keep the rate even. So no matter what breathing pattern that you choose, we know that by breathing and beginning with a deep cleansing breath, or really like a sigh, at the beginning, at the end of the contraction is a good thing. So it sounds something like this. And what you're doing is giving that baby a whopping dose of oxygen. The next thing that I want you to do when you're having a contraction is to focus on something in the room or to close your eyes while you breathe in through your nose and out through your mouth. Now, some of you throughout the pregnancy have had a chronic stuffy nose, and that's okay too. If you're having that problem, then you just will become a mouth breather through these contractions. However, breathing through your mouth makes you get really a dry mouth, and you'll just want to make sure you have plenty of ice chips to conquer the dry mouth in between the contractions. So to get started, I ask you to find a comfortable position so that it's easier for you to relax while you're doing these contraction breathing patterns. Now, you wouldn't want to start these breathing patterns when you have your first contraction. At the beginning of labor, you don't usually need them. Remember that early labor is exciting and the contractions are often mild. You may want to wait until the active labor begins before starting the breathing patterns. You'll know when, because the work of labor may change how you feel. Now the first one, and this happens to be my favorite one, is a slow-paced breathing pattern. And the reason I like it is that most of the experts agree that breathing slow is better. Most women, when they experience the difficulty of labor, either tend to hold their breath or breathe too fast, and we know that neither is a good thing. So by doing the slow-paced breathing, you begin with a cleansing breath, and it's and then you keep your rhythm even. Now normally we breathe somewhere between 16 and 20 times a minute. This is about half that fast. The rate is slow, and again, we're going to end with a cleansing breath. So it goes something like this. Contraction begins, deep cleansing breath. And then in and out. And in and out. And so it repeats until the contraction begins to go away and you end with a deep cleansing breath, which is, and that is all there is to it. Now imagine when you're doing this that you're just filling your lungs up as much as you can. Sometimes it helps to have your labor partner to count for you. If they're counting, it would be in, 2, 3, 4, out, 2, 3, 4. And it's good to practice this. If you can practice doing a contraction 3 times a day, trying it for about a minute, then it works very well, because when you need it, it will come naturally to you. Now some women along the same time like to practice effleurage, where they take their fingertips and very lightly stroke their abdomen. And you may notice that you're already doing that. Some women do it and they aren't even aware. But this effleurage works very well with the slow-paced breathing, and it helps you to relax. So if you can go throughout your whole labor with this type of breathing, that's great. But some women find that they need to breathe a little bit faster. Now the problem with breathing fast, if you breathe fast and deep, it's known as hyperventilation. And how you would know if you were doing that is if you were breathing so fast that you began to feel sick to your stomach, dizzy, lightheaded, or tingly. Some people feel that they're tingling around their mouth, or their hands start to tingle if they're hyperventilating. To counter that, you try to slow your breathing down, or you would take your hands and cup them over your face and rebreathe the carbon dioxide that you've been blowing out. So some people like to breathe faster, but we encourage them to breathe shallow. So to do this, you would take a deep cleansing breath when the contraction begins and relax. Concentrate on your focal point, and then breathe slowly through a relaxed mouth. Have your lips slightly open and have your tongue between your teeth, so that when you breathe out, it sounds like practice that for a minute. Just like a cat. So gradually, you increase the rate as your contraction peaks, and then you start to slow back down as your contraction becomes less painful. And then at the end, you follow it by a deep cleansing breath. And you do that to however it feels the most comfortable to you. But just remember, if you're breathing fast, you need to breathe shallow, and to do that, the tongue goes between the teeth like and that is shallow breathing. Now, some women like to practice pant-blow breathing, and you can do this several ways. You can do it in 3-to-1 ratio, where you're breathing shallow and it's followed by a quick blow, or you can do more breaths, as much as 6 times to 1 blow. So to practice this, again, you take a deep cleansing breath, and then relax, and then get your focal point, and then it's 3 shallow breaths, and you blow. Again. And so it goes until the contraction goes away, and then follow it with a cleansing breath. So again, if you could find time to practice 3 times a day, it would actually help you be able to draw on it when you need it. Now, there are other patterns that people make up. None is right, none is wrong. It's what works for you. However, some women experience the urge to push, and we encourage them not to do that until they're given permission either by their nurse or their physician. To counter that urge to push, we ask you to pant or blow, because we know that if you're panting or blowing, then you cannot push. So it looks silly, I know, I realize that, but if your nurse tells you, okay, don't push, we want you to pant or we want you to blow, you sound like this. Or and you do that until the urge to push goes away. We never practice pushing while we're pregnant. We will only wait and do that when we have permission from our nurse or our physician. Now, several times during the day, if you can, practice relaxing, shutting your phone off, turning the television off, getting in a comfortable position, hopefully on your side, maybe with a pillow between your knees, one to your back, and listen to music, because we know that relaxing to music is something that most of us do on a regular basis. You may be listening to music in your car, and be thinking, what kind of music am I going to bring with me to labor?